In this video, we are going to discuss about the muscles of adductor or medial compartment of the thigh. So, we are discussing about the muscles of adductor compartment of the thigh. So, I will discuss it one by one. So, the muscles of adductor compartment can be divided into muscles which form the superficial stratum, muscles which form the intermediate stratum, and the muscles which form the deep stratum. So, which are the muscles present in the superficial stratum? So, in the superficial stratum, you have three muscles, that is the pectineus muscle, the adductor longus muscle, and gracilis muscle. So, first we are going to discuss about the pectineus muscle. So, about the pectineus muscle. So, we will discuss the origin, insertion, nerve supply, and action of the muscle. So, this is a superior ramus of pubis. This is the inferior ramus of pubis, body of pubis. This is the ramus of ischium. This is the ischial tuberosity. This is the acetabulum. And you have the head of humor here. So this pectineus muscle is actually originating from the uh, pectineal surface, that is the pecten pubis and the pectineal surface of superior ramus of pubis. So it is originating from this part. This is the pecten pubis. So origin is from pecten pubis and pectineal surface of superior ramus of pubis. Pubis. That is the origin of this muscle. Now it is a quadrilateral muscle, and the muscle passes like this. Now it passes little into the posterior aspect. Now what is the insertion of the muscle? Now if we take the posterior aspect of the femur, so this is the posterior aspect, this is the greater trochanter, this is the lesser trochanter. So this is the medial aspect, this is the lateral aspect. Now you can see a line here, this is the linea aspera and this is the lesser trochanter. Now the pectineus gets inserted into a line extending from the lesser trochanter of femur to the linea, upper part of linea aspera. So it gets inserted here. So this is the point of insertion of the pectineus, that is upper part of line extending from lesser trochanter to upper part of linea aspera. Now what is the nerve supply of this muscle? Now what is the nerve supply of this muscle? Now know that this is a hybrid muscle. It is having dual nerve supply, and it has got an anterior most portion, that is the anterior fiber. It has got a posterior fiber. Now anterior fiber is supplied by the anterior division of, it is supplied by femoral nerve. Now posterior fibers are supplied by the posterior division of obturator nerve. So this is a muscle which is having dual nerve supply. So it is a hybrid muscle or a composite muscle. Now what is the action of this muscle? Action of this muscle is, now the main action is, flexion of the hip. It carries out flexion of the hip. Flexion of hip is an action, and it is also an adductor. So being a muscle of adductor compartment, it also helps in adduction of hip. The main action is flexion of the hip and adductor of the hip. So that's all about the pectineus muscle. So this is one of the muscle which forms a superficial strata. Now another muscle is the which belongs to the superficial strata is the adductor longus muscle. Which is the muscle? Adductor longus muscle. Now we will be drawing the origin and insertion of the muscle here. The origin of this muscle is from the body of pubis. It originates from the body of pubis. So body of pubis. Anterior surface of body of pubis. Now it is a triangular muscle. It is triangular in shape. Now it gets inserted where we should see the posterior aspect of femur to see the insertion of the muscle. So this is the medial aspect, this is the lateral aspect. What you see here is the lesser trochanter, this is the greater trochanter, and there is a line here, that is the linea aspera when seen from the posterior aspect. Now this muscle, which is a triangular muscle which is originating from the body of pubis, it passes posteriorly and gets inserted into the linea aspera in the middle 1/3 of shaft of femur. It gets inserted here in middle 1/3 of shaft of femur. So this is the site of insertion. So insertion is at linea aspera in middle 1/3 of shaft of femur. Now what is the nerve supply? What is the nerve supply? It is supplied by the anterior division of obturator nerve. Anterior division of obturator nerve. Now the action of this muscle is, it is a powerful adductor of the hip joint. So main action is adduction of hip joint. It is a powerful adductor of hip joint, and this is acting as a posture controllers. Now it also carries out flexion of hip joint and medial rotation. Medial rotation. So action is adduction, flexion and medial rotation at hip joint. So that's all about adductor longus muscle. Now which is the other muscle belonging to the superficial stratum? That is the gracilis muscle. Gracilis. Now what is the origin and insertion of this muscle? Now the origin and insertion of this muscle. The gracilis muscle is originating like this. It has its origin from the medial margin of lower half of body of pubis, that is body of pubis, that is medial margin of body of pubis. Now inferior ramus of pubis and adjoining part of ramus of ischium. So these are the sites of origin. Now this is one muscle of the adductor compartment which gets attached to the tibia. If this is the tibia, it gets attached into the upper part of medial surface of tibia. So this muscle arises like this and it gets attached to the upper part of medial surface of tibia. This is the muscle. Upper part of medial surface of tibia. So this is the insertion is just behind this arteries. If this is the arteries and in front of the semitendinosus muscle. So what is the nerve supply? It is also supplied by anterior division of obturator nerve. Now what is the action? It also carries out flexion, medial rotation at the hip joint, and it is also a weak adductor of thigh. So being a muscle of adductor compartment, it also helps in adduction, but it's a weak adductor of thigh. So its action is adduction, medial rotation and flexion of the thigh at the hip joint. So which are the muscles forming the superficial strata? Muscles forming the superficial strata are so muscles uppermost one is the we have seen as the pectineus, originating from the pecten pubis and is attached to the posterior aspect. So this was a pectineus muscle. So we have seen the attachment while seeing the posterior aspect of femur. Next muscle is the adductor longus muscle. This is originating from here. It is a triangular muscle and gets attached like this. This is the adductor longus muscle. And which is another muscle which forms the superficial strata, that is the gracilis muscle. So these three muscles forming the superficial strata of the adductor compartment of the thigh. So next we are discussing about the muscles forming the intermediate strata, and these muscles are deep to the superficial strata muscles. So what are the muscles forming the intermediate strata of the adductor compartment? So intermediate strata is formed by two muscles. One is the adductor brevis muscle. Now adductor brevis muscle, and there is obturator externus muscle. So adductor brevis muscle, we are going to discuss about it, the origin and insertion. So the adductor brevis muscle is originating like this. So it also originates on the body of pubis, inferior ramus of the pubis and ramus of ischium. Now body of pubis, ramus, inferior ramus of ischium, ramus of pubis, ramus of ischium. Now this muscle passes like this. Now this muscle is lying posterior to the pectineus muscle and the upper part of adductor longus muscle. So this muscle is lying deep to the pectineus and the upper part of adductor longus muscle. Now it gets attached here. Now we will see the posterior aspect of the femur. So this is a posterior aspect. You see the linea aspera here. So we have seen the attachment of the adductor longus muscle here, and we have seen the attachment of the pectineus muscle here. Now this adductor brevis muscle is attached to a line extending from the lesser trochanter to the upper part of linea aspera behind this. So this is the attachment line extending from behind the upper part of adductor longus, extending from lesser trochanter to upper part of linea aspera. So this muscle belongs to the intermediate stratum of the adductor muscles. So lying above this muscle is the pectineus. We have seen the pectineus muscle which is lying above this muscle, and we have the adductor longus which is lying over upper part of adductor longus which is lying over this muscle. So anterior to this muscle you have the pectineus and upper part of adductor longus. Now attachment is behind adductor longus. You have adductor longus attached here. Adductor longus. Now what is the nerve supply? You have seen that this muscle is lying deep to the superficial strata muscle. So it may be supplied by the anterior or posterior. Sometimes it is supplied by the posterior division also. So anterior or posterior division of obturator nerve. Obturator nerve. Now what is the action? So it is an adductor brevis. So action is, it is an adductor medial rotator, adduction, medial rotation, and flexion of hip joint. Flexion of hip joint. Flexion of thigh at the hip joint. So that is the action. Now another muscle which is lying in the intermediate stratum is the obturator externus muscle. Which is that muscle? That is the obturator externus. Actually this muscle is a part of adductor compartment, but the function is different. Now this muscle is originating from the outer margins of obturator foramen and the ramus of the pubis lying around the foramen and gets passes through the gluteal region, and it gets inserted into the trochanteric fossa. Now this also forms a part of adductor muscle, but its function is lateral rotator of thigh at hip joint. It is the lateral rotator of thigh at hip joint. Now the nerve supply is, it is lying posteriorly, no? So it is supplied by the posterior division of obturator nerve. Now we have other muscle which is an important. This is the largest muscle of the adductor compartment, and it is present in the deep strata. That is, this is the deepest muscle. That is the adductor magnus. It is the largest and deepest muscle of adductor compartment. That is adductor magnus. Actually, this has got two heads. That is, it has got two parts. First one is an adductor part, and it has got an hamstring part, or it is also known as ischial part. Now look at the each parts here. Now you can see that the adductor part is originating from the this part, that is inferior ramus of pubis, ramus of ischium. So this is the origin of adductor part. Adductor part is so this is the origin of adductor part, that is the inferior ramus of pubis and inferior ramus of ischium. Ramus of ischium. And it has got a hamstring part. Now the hamstring part of this muscle is originating from the ischial tuberosity. Ischial tuberosity. That is the hamstring part or ischial part. Now this muscle passes like this. Now on the posterior aspect, it gets attached to the, now the adductor part, it gets attached to the medial lip of the gluteal tuberosity. It gets attached to the linea aspera and upper part of medial supracondylar line. Upper part of medial supracondylar line. So this muscle, it passes like this. Passes posteriorly and gets attached first to the, that is the adductor part. Now I am saying about the attachment of the adductor part. It gets attached to the gluteal tuberosity, medial margin of gluteal tuberosity. Now what you see here, so it gets attached to the linea aspera behind the adductor longus muscle. Linea aspera, upper part of medial supracondylar line. Medial supracondylar line. So that's about the attachment of the adductor part. Now the hamstring part, which originates from the ischial tuberosity, gets attached to the adductor tubercle. It gets attached to the adductor tubercle. So gets attached to the adductor tubercle. That's the hamstring part. Now this is also hybrid muscle. It has got dual nerve supply. Hybrid muscle, because the adductor part supplied by the posterior. This is posterior. In the adductor compartment, it is lying. It is a posterior muscle, so it is supplied by the posterior division of obturator nerve. Division of obturator nerve. Now, the hamstring part is supplied by the tibial part of sciatic nerve. No, so it is a hybrid muscle as it has got dual nerve supply. Now the action is important. Now the two parts, both the adductor part and hamstring part, carries out adduction of the hip joint. So adduction is important. Now the adductor part carries out flexion and medial rotation at hip joint. At hip joint. Now the hamstring part carries out extension at hip joint and flexion of knee joint. So that's the action. It has got different action. That is, adductor part carries out flexion and medial rotation at hip joint, whereas hamstring part carries out extension at hip joint. And this adductor magnus muscle as such carries out adduction at the hip joint. So we have seen that so when we see from this side, the most superficial muscles are the pectineus muscle. That is the pectineus muscle, which is a quadrilateral muscle, and we have the adductor longus muscle, and we have the gracilis muscle. So gracilis muscle. It gets attached to the posterior aspect, and deep to this muscle. So this is the pectineus, this is adductor longus, this is gracilis, and deep to this muscle, that is deep to the pectineus and adductor longus, you have adductor brevis, and you have one bulky muscle which is lying posterior to all these muscles, that is the adductor magnus muscle, which is lying posterior to all this muscle, that is the adductor magnus muscle, that is a bulky muscle. And you have obturator externus, which also forms a part of adductor compartment, but it carries out lateral rotation of hip joint, which is a different function, different from all this muscle. So which are the muscles of adductor compartment? That is pectineus, adductor longus, gracilis, adductor brevis, obturator externus, and adductor magnus. So that's all about muscles of adductor compartment. Thank you for watching this video. To see more videos on our channel, please subscribe the channel. Thank you.